to the Late Night Talks with Carmela. I am your host, Miss Carmela Diaz. Today we are talking about how to deal with depression and suicidal tendencies, especially for teenagers. Our guest today is a mental health expert, Dr. Hans Benitez.
Thank you for having me here.
So, Dr. Benitez, let's start with the basics. Can you tell us about what depression is and how it affects teenagers?
Sure. Depression is a mental health disorder that affects how a person thinks, feels, and behaves. It characterized by persistent feelings of sadness, hopelessness, and lack of interest in things. Depression can affect anyone, regardless about their age, gender, background. It can also affect on a significant impact on a person's relationships, work, and overall quality of life.
That's really helpful, Dr. Benitez. So, can you tell us more some common symptoms of depression in teenagers?
Sure. Some common symptoms of depression in teenagers is the lack of sleep patterns and change in appetite. Concentrating on making decision, there are some difficulties of that, and also the physical symptoms like fatigue, headaches, or muscle pain. Teenagers may also withdraw from their friends, family.
Thank you so much, Dr. Benitez. What kind of treatments are available for depressions in teenagers?
There are several treatments available for depression in teenagers, including medication, psychotherapy, alternative therapies like psychotherapy, also known as talk therapy, is a type of treatment that involves talking with a mental health provider to learn on coping skills and strategies for managing depression. It can be done one on one in a group settings. The goal of psychotherapy is to help teenagers identify and also change negative thoughts, patterns, and behaviors that contribute to their depression.
So let us welcome Ms. Farah Panugaling and Ms. Chaminje Abelia.
Good evening.
Good evening.
Good evening.
Good evening.
Sit down, sit down.
So, good evening, Ms. Chairman and Farah. Can you tell us what did you experience about depression?
So I suffer from depression. It can be very tough sometimes, but I found out that talking to someone has been really helpful for me.
What about you, Ms. Farah?
So good evening. I suffer from depression, but I found out that exercise and self-care have been really helpful for managing my depression.
That's very smart. Can I ask you a question?
Yes.
Are you seeing any help for professionals?
Yes. It's been a month now since I go to my psychiatrist, or should I say my doctor, and I feel better now.
For the audiences there, I want you to know that if you are suffering from depression, that depression is treatable and it has so many resources to help you, and it's important that you should reach out for help.
Much, and I hope all of you guys enlighten your minds that depression is treatable and there is someone you can count on to share your problems. Please, there is no man in an island. Thank you so much, guys.
Thank you.
Thank you.
Thank you so much. Again, everyone, this is your host, Miss Carmela Diaz. See you next time.